Acute Hepatitis by Maddie Gomez, Heidi Kelly, Samantha Lopez, and Sergio Torres. What is hepatitis? Simply put, hepatitis is an extensive inflammation of the liver that ends in deterioration and necrosis of liver cells. More than 80,000 new cases of hepatitis are reported annually in the US. In many cases, the damage is reversible after the acute phase. However, in some cases, extensive necrosis leads to liver failure and may result in death. Acute viral hepatitis is a major public health concern because it is highly contagious and is spread before symptom onset at times. Causes of hepatitis include bacteria, hepatotoxic agents such as drugs and alcohol, and industrial chemicals, but it is most typically caused by a virus. The 5 agents most frequently recognized as the cause of acute viral hepatitis would be hepatitis A, B, C, D, and E virus. Many viruses cause hepatitis, but there are 3 most common. Top 3 would be hepatitis A, B, and C. Hepatitis A accounts 45 to 50% of the cases, hepatitis B 30 to 35% of all the cases, and hepatitis C, which accounts for 15 to 20% of the cases of the total people living with hepatitis. Hepatitis A. Route of transmission for hepatitis A is fecal-oral, blood, and sexual contact. At-risk individuals would be military personnel, children in daycare, incidence is rising in male homosexuals, and it is common with people with HIV infections. Hepatitis B. Hepatitis B is spread in many ways. This includes blood, sexual contact, perinatal contact. At-risk individuals would include IV drug users, Native Asians, healthcare workers, transfusion recipients. Hepatitis C. Hepatitis C is spread in many ways. This includes blood, sexual contact, perinatal contact, and some unknown causes. At-risk individuals would include IV drug users, healthcare workers, and transfusion recipients. Below is a graph that you can see how hepatitis is spread. As you can see, the 10% of the graph is unknown, 5% is through some sort of healthcare work or perinatal. The other 10% is through transfusion before screening. 50% is sexual, and most of it, 60%, is related to IV drug use and sharing needles. Clinical manifestations of hepatitis. Many patients with acute hepatitis will not have any symptoms and may not even realize they've been infected. Other patients may experience anything from a minor flu illness to complete liver failure, resulting in death. The severity of symptoms and speed of recovery can vary considerably among individuals. Depending on the particular virus and the infected person's immune response to the pathogen, hepatitis A and C usually cause trivial symptoms or even none at all, may go unnoticed for some time. Hepatitis B and E are more likely to produce significant symptoms. Infection with both hepatitis B and D, termed a co-infection, may take the symptoms of hepatitis B even more severe. Symptoms of acute viral hepatitis usually begin suddenly. They include anorexia, decreased sense of smell and taste, diarrhea or constipation, fatigue, lethargy, and malaise, nausea and vomiting, hepatomegaly, clay-colored stools, low-grade fever, myalgias and arthralgias, pruritus, pain in the upper right quadrant where the liver is located, and in people who smoke, a sudden distaste for cigarettes is common. 3 to 10 after the initial infection, the urine becomes dark and jaundice develops. These symptoms occur because the damaged liver cannot remove bilirubin from the blood as it normally does. Bilirubin then builds up in the blood and is deposited in the skin and whites of the eyes. This will most likely be shown in the sclera. Bilirubin is a yellow pigment produced as a waste product during the normal breakdown of red blood cells. The liver uses it to make bile, the greenish-yellow digestive fluid produced by the liver. Urine is dark because more bilirubin is eliminated in the urine than is usual. Symptoms of cholestasis, a reduction or stoppage of bile flow, such as pale stools and overall itchiness, may also develop. Diagnostic testing. In diagnostic testing, the AST, ALT, GTT, and ALP would be elevated if hepatitis is present. Serum albumin would be normal to decreased, serum globulin would be normal to increased, and serum bilirubin increases to 8 to 15 milligrams per deciliter. Normal serum bilirubin is usually 1.2 milligrams per deciliter. Other diagnostic testing would be urinary bilirubin. This will be increased due to conjugated hyperbilirubemia. This causes dark-colored urine. Urinary urobilinogen increases 2 to 5 days before jaundice, caused by the diminished reabsorption of urobilinogen. Prothrombin time becomes prolonged because of the liver. It produces less prothrombin. Drug therapy for hepatitis. There aren't any treatments available to those who have acute hepatitis A virus. Patients with hepatitis B virus only receive treatment if they have severe hepatitis and liver failure. Some patients who are infected with acute hepatitis C choose to take a direct-acting antiviral. However, these are usually taken by those who progress to chronic hepatitis. The cure for hepatitis C can be very costly. Supportive drug therapy includes antihistamines to relieve itching caused by hepatitis, and antiemetics to help relieve nausea and vomiting. Two most common antiemetics would include Phenergan and Zofran. Nursing and collaborative treatments. Adequate nutrition. This may be difficult to achieve because the patient may experience nausea and food aversions. The body may not tolerate foods, especially those high in fat. Emphasis on nutrition includes a well-balanced diet that the patient can tolerate. Vitamins, supplements are frequently used, specifically vitamin K and B complex vitamins. Fluid and electrolyte balance must be maintained. If the patient is experiencing severe nausea, vomiting, or anorexia, IV solutions of glucose or enteral nutrition therapy may be used. Get rest. Rest decreases the metabolic requirement on the liver and promotes liver cell regeneration. Collaborate with the doctor for the strictness of rest and when the patient can resume work or their normal ADLs. Avoid alcohol and drugs detoxified by the liver. Counseling may be needed to help promote abstinence of drugs and or alcohol. We love nursing diagnoses. Nursing diagnoses 1. Imbalanced nutrition, less than body requirements, related to anorexia and nausea. Number 2. Activity intolerance related to fatigue and weakness. Number 3. Acute pain related to edema of the liver. And last but not least, nursing diagnosis number 4. Deficient fluid volume related to nausea and vomiting. This sums up to our complications. The overall mortality rate for acute hepatitis is less than 1%, but these complications can occur during acute hepatitis. Acute liver failure. If the liver function diminishes completely during acute hepatitis, it can lead to acute liver failure, which would require a liver transplant in order to sustain life. Another complication, chronic hepatitis is defined as an inflammation of the liver for 6 months or longer. So untreated acute hepatitis often results in chronic hepatitis. It is important that patients are seen when symptoms occur, because this likely means that the infection has already been present for some time. Hepatitis C most commonly causes chronic hepatitis, as about 75% of cases of acute hepatitis C infections lead to chronic hepatitis. Cirrhosis of the liver is defined as scarring of the liver, which occurs when the liver tries to repair itself and scar tissue forms. Inflammation occurs due to the infection, which leads to the cirrhosis. Cirrhosis causes impaired liver function, and then signs do not present themselves until the damage is very severe. Another complication is portal hypertension. Portal hypertension can occur due to the scarring within the liver from the infection or cirrhosis. The scarring then blocks the flow of blood flow through the liver, causing portal hypertension. Lastly, hepatocellular carcinoma is most commonly caused by chronic hepatitis and cirrhosis due to chronic inflammation, which can both occur due to acute hepatitis.